I'm traveling the state, invited Congressman Collins to be with me today. Following up on the VA, I'm a member of the Veterans Affairs Committee in Washington, have been for 10 years. The crisis in VA health care is known to everybody with the problems that have taken place over the last couple of years, the discoveries that have been made. I caution everybody to not paint with a broad brush. 9 out of 10 calls that I get from veterans are veterans who are bragging about the VA health care and the services they get and they don't want to lose it. But one problem and one mistake is too many when you talk about the quality of health care for somebody who served our country. Congressman Collins and I both are veterans of the United States Air Force. He's still in the reserves. We understand the sacrifices made by our veterans, and we understand the problem. If somebody loses their life because the appointment's not kept, a mental health patient is not followed up on as they should be, and it's time for Congress to get in and take action. We took action in July. We passed a comprehensive bill through the House and the Senate. It adds about $25 billion in investment in VA health care, expands the number of clinics in the country by 27, one new one in Georgia, gives the private option at the volition of the veteran. If they can't get an appointment in 30 days or they live more than 40 miles from a VA facility, they can go to a private practitioner as long as they're approved by Medicare. And we've got now given the VA administration and the leadership the ability to fire somebody. VA didn't have the authority to fire anybody, so they would move people at the same level of pay if it was discipline. That's not discipline, and that's not accountability. And then now Dr. Hamilton gave a good briefing today. The Visiting Director Sepich is here today, and he's traveled with me through all these hearings. We're getting the answers that we need to get to make sure that the VA is performing at the top level.
This is not a time in which Congress is simply passing a bill and feel like everything's fixed. The Senator's made this comment before, and I'll echo that comment. This is something we're going to be following up on. This is something that's not going away. If the VA administration feels like that the bill's passed, we can go back and sort of maybe take it easy out of the spotlight. That's not going to be true. I know the Senator's going to follow up on it, and we're going to be following up.